Hello, and welcome to the Insignia Instructional Bonding Modules. They've been designed to provide everything you need to know for that first Insignia bonding appointment. In addition, they're organized so you can come back anytime to access just the information you need. Okay, let's get started with the setup. Box inspection. First, start by establishing a plan for your Insignia bonding. You want to review the contents of the patient's kit, and having the correct view in the approver software allows you to have all the information you need up front. Review the kit and its contents. The custom prescription brackets and custom fit placement jigs will be arranged by quadrant. The wires. You will have 6 upper and 6 lower wires with labels. A set of individual replacement jigs for each tooth. The first and second molars have tubes already loaded. And finally, the case paperwork. You should pay special attention to this page. It tells you of any jig interferences to be aware of during the bonding. It also indicates if you need to bond a bracket at a later date because of an interference. Now that you have a sense for the kit contents, open the patient's case in the approver software. Ideally, you are doing this at chairside. It's recommended that you have the AI approver available at each workstation. At the workstation, log in to ormcodigital.com. Find the patient's case in the approver software. Once the case opens up, click on the T1 button to view the patient's current occlusion. Then, click on the bracket icon to add brackets to the teeth. This view lets you plan the bonding and review the case for any interferences that may be noted in the case paperwork. Bonding tray recommendations. Now it's time to get the bonding tray organized. Here's the recommended way to set up your tray. For isolation, we recommend using the OptiView lip and cheek retractor. Use a medium-bodied adhesive. A few good options are Nlite LV or Transbond LR. Viscosity of the adhesive is important here. The adhesive needs to be more flowable than what is traditionally used for direct bonding. The adhesive should be at room temperature, so if you keep yours in the fridge, it's not going to flow properly. Etch. It should be 37% phosphoric. Ortho Solo. Slim Weingart plier for jig removal. Cotton tweezer or plier for jig placement. Spintech opening and closing instrument for the brackets. Micro brushes. And finally, band pusher and scaler. If you don't have any of these items, please contact your Ormco representative. That's it. Your tray is ready to go, and you're prepared to see the patient. Isolation. Prepare teeth as normal, prophy, etch, and dry. To start the isolation, begin with putting dry angles in on both sides of the mouth. These help to keep the cheeks out of the way and keep everything dry. Next, use the cheek retractors. We recommend OptiView here, as these tend to be comfortable for patients. This gives you a clear view of everything with good access to the posterior. To isolate one side and control the position of the tongue, you may need a tongue guard. Now that the isolation is complete, it's time to prep the teeth. Tooth preparation and dry fitting. If you're new to Insignia bonding, once the cheek retractor is in, dry fit the jigs. It makes you more comfortable handling them and more confident, knowing exactly how you should be positioned and how the jig will fit onto the teeth. If you've dry fitted, dry the bracket pad and jig. Acetone may be used on the pad should the doctor feel it's required. It is recommended to only prepare the teeth of the grouped jig that will be bonded to ensure proper isolation. It's very important to leave the etch on for the manufacturer's recommended time, and that's typically between 15 to 30 seconds for each tooth. Rinse thoroughly for a minimum of 5 seconds per tooth with water, spray, and dry. Now a very important step. Apply Ortho Solo to seal the teeth. No air dry or light cure step is needed. Next, the brackets will be loaded with adhesive in order to be placed. Repeat this tooth preparation process for each area to be bonded. Loading adhesive to the bracket pads. Getting the right amount of adhesive on the bracket pad is an important step in this process. Place enough adhesive to cover the pad with a thin coat. The amount of adhesive used here is recommended. Here, we see an example of too much adhesive. This can lead to bond failure. It's important to wet the flat plastic instrument with Ortho Solo prior to buttering the adhesive, as this will stop the adhesive from sticking to the instrument. Using a medium-sized flat plastic instrument, butter the adhesive into the pad evenly. Once the adhesive is properly loaded on each bracket, the jig grouping is ready to be seated. Jig placement and curing. It is recommended that you have the patient tilt their head slightly towards you. This makes it easy to place the jigs. To avoid moisture contamination, bond one side of the patient first, upper and lower posterior jigs, then the other side, and finally the anterior teeth. When placing posterior jigs, use a cotton tweezer or positive positioner. These are the perfect angle and are small enough to go to the 7s if you're working with a single tooth jig. Grip the jigs by holding the most mesial tooth. If you prefer, you can use your hands. With anterior jigs, we recommend using your hands. Once you have a proper grip, you want to come in from the lingual and roll to the buccal fascial, making sure not to sweep the adhesive onto the front of the tooth by sliding it down. Once seated, you want to make sure the bracket pads are flush against the teeth. To ensure the pads are against the teeth, maintain pressure on the jig with a 45-degree angle. If there is any flash, use a micro brush dipped in Ortho Solo to clean all accessible sides of the bracket. Any flash on the occlusal side of the pad can easily be cleaned with a handpiece afterwards. While maintaining a fairly firm finger pressure at a 45-degree angle, you can do a half cure of each bracket, enough to be able to release finger pressure and then complete the second half of the curing process. If 2 team members are available, one can cure while the other maintains finger pressure. Jig removal and flash cleanup. Here is the proper way to release the jigs from the brackets. With the slim Weingart plier, from the occlusal, grip the jig and rock buccolingually. Begin on the mesial end and work to distal until it's released, and gently remove by rolling to the lingual. You can also remove the jig from the buccal aspect by gripping the area between each bracket and gently rocking. Make sure everything is slightly dislodged before trying to completely remove it. Take time in loosening each tooth. Here's a tip. The glue that holds the brackets into the jigs is water-soluble. That means you can lightly spray the bracket with water for several seconds, and the jig will come off smoothly. This step isn't required, but it is useful if you're struggling to remove the jig. Repeat these steps for each quadrant. Etch, rinse, dry, apply primer, apply adhesive, seat the jig, light cure, and remove the jig. Once all the brackets are bonded, remove the cheek retractor and remove flash with a handpiece and a fine-fluted finishing burr. As mentioned earlier, if you have the correct amount of adhesive on the pad, there shouldn't be much flash. Doctor check. Now the brackets are on and the flash has been removed. It's time for the physician to come in and check the bracket positions to ensure that they align with what was approved in the AI Approver software. At this point, disarticulate the arches and insert the initial wire. Stock copper Nitai round wires are recommended at the initial bonding. As treatment progresses and it's appropriate, move on to the custom Insignia rectangular wires. If you plan for elastics, you will know ahead of time which brackets will need drop-in hooks. With Insignia, they are inserted through the horizontal auxiliary slot and crimped straight back towards the tooth. Use of replacement jigs and troubleshooting. If you're bonding a quadrant and one or more brackets don't bond to the tooth, you want to prepare the jig by cutting the receiving arms off with a wire cutter. Use a burr to remove any glue from the tooth. Micro-etch the bracket to remove the rest of the glue. Rinse and dry with an airstream. Now you're ready to rebond that bracket. Now in the case of bond failure after the initial bonding, each patient kit contains a set of replacement jigs. The first and second molars have preloaded buccal tubes. Just separate out the tooth you need, prepare the tooth, load the bracket, and bond the bracket just like you did with the quadrants. If you find yourself needing to order a replacement part, a bracket or a wire, you do so at ormcodedigital.com. That's it! Thank you for learning more about bonding Insignia brackets. Feel free to come back at any time for specific information. It's also helpful for assistants to become familiar with this process so that they can know what will be expected of them chairside when an Insignia bond is on the schedule. Thanks for watching, and enjoy Insignia.